This morning, Face Off, an amazing and controversial medical breakthrough, the world's first face transplant. How did they do it, and will the patient look like herself again or somebody else?
From Times Square, this is Good Morning America with Charles Gibson, Diane Sawyer, and Robin Roberts.
And good morning to all of you. Charlie, Robin, and I welcome you on the first day of December, but we've all been talking about this big story in the headlines.
Yeah, really a fascinating medical story. I'm sure you've heard about it. The partial face transplant, never been done before, like something out of a sci-fi movie. All the details coming up, and yes, it is quite controversial.
We heard they were going to try it. It has now been done. A team of doctors in France has performed the world's first face transplant. It was risky, controversial, but it is an amazing breakthrough. We're going to begin our reports. Been warning you a little bit that this is slightly graphic, but we want to tell you exactly what happened, and ABC's Dan Harris has the details.
The partial face transplant was performed on Sunday at this hospital in France. The patient, who wants to remain anonymous, is a 38-year-old woman who was severely disfigured after a dog bite. The procedure involved taking the nose, lips, and chin from a brain-dead donor and grafting them onto the patient's face. The lead surgeon, Dr. Jean-Michel Dubernard, is famed for performing the first hand and first double forearm transplants. Dr. Nadi Hakim has collaborated with him.
It is significant because if it does work, it will open a lot of avenues for many patients who have lost their face either due to burns or even cancer.
Even if it was a full facial transplant, it would not look like it does in the movie Face Off. Patients would not end up with someone else's face.
The recipient will not look exactly like the donor. In essence, they'll look like a hybrid because you'll have the soft tissue from the donor and the underlying bony structure of the recipient.
Teams in the U.S. and in Europe are working toward a full facial transplant. In Cleveland, they're already interviewing possible patients. Meanwhile, in France, doctors say their patient is in excellent condition, but there is still a danger that her body could reject the new tissue. Tomorrow, in a press conference, they will provide new details about a procedure that has pushed the boundaries of medical science and ethics. For Good Morning America, Dan Harris, ABC News, New York.